Hello, I'm going to be talking about the coronavirus and the coronavirus disease, COVID-19. The focus of this presentation is going to be on what we all need to know and do to prevent and mitigate transmission and infection. The focus will be on public health strategies. The four big focus areas are, first I'm going to start off by talking about the basic facts, what we know now about COVID-19. Then I'm going to go into pandemic levels and how we can start to look at this current pandemic around screening, comparison with other countries, and flattening the curve. A focus on what we can do proactively, and then reliable sources and newsletters that you can sign up and bookmark to stay on top of what's going on with COVID-19. So first, let's start off with just basic facts of what we know about the coronavirus and COVID-19. This is directly from the World Health Organization. What is coronavirus? Coronavirus is our large family of viruses which may cause illnesses in animals or humans. In humans, several coronaviruses are known. You know these already. They cause respiratory infections ranging from the common cold to more severe diseases. What's unique about COVID-19 is this is an infectious disease caused by the most recently discovered strand of coronavirus, and this is a new virus strand, and there's currently no immunity or current vaccination for this. And this is something, again, that I've pulled from the World Health Organization, which has a great frequently asked questions area. So transmission. When you have a new virus, one of the big things that public health strategies like to focus in on is breaking the transmission. So knowing how this virus is spread is really important in breaking the transmission. So first, the virus can spread from person to person through small droplets from the nose or mouth, which are spread when a person is infected with the virus or diagnosed with COVID-19, coughs or exhales. And I focus in on with a person who's infected with the virus because someone could be asymptomatic and not have developed the symptoms yet. The other is these droplets then land on objects and surfaces around the person. The other people then catch the virus by touching these objects or surfaces, then touching their eyes, nose, or mouth. So breaking the transmission of the person touching their eyes, nose, or mouth is really critical. That's why you've been seeing all these hand washing messaging. The virus may persist on surfaces for a few hours or up to several days. And I put an asterisk by this because note, World Health Association is assessing and ongoing research on ways COVID-19 is spread and post update findings almost daily. So you'll see varying research and data around this. So it's the novelty of this too. This is new. So one other big thing is that people can also become infected with the virus if they breathe in the droplets from a person who's infected and or diagnosed with the disease when they cough or exhale the droplets. And this is why it's so important to stay more than 1 meter, 3 feet. And you'll see some messaging out there that extends that out to 6 feet. So the minimum is 3 feet, but really having a good social distancing of at least 6 feet is critical. And now you see the logic of why the hand washing messaging and also the social distancing. This is about how you break transmission. So with that then, let's talk about the symptoms. You know how it's transmitted. What are some of the big symptoms? One of the most common symptoms is fever. The majority of people that they're seeing right now present with a fever, followed by a dry cough and then difficulty breathing. And they are saying that people are starting to show symptoms as early as 2 days or as long as 14 days. I've heard estimates that the average is around 5. But we're seeing a lot of different things. Again, we're learning about this new disease. Some patients may have aches, pains, nasal congestion, runny nose, sore throat, or diarrhea. At one point I had mild here, but mild's really relative because it's pretty intense. And so some people can have a mixture of these. Some people infected, but they don't develop any symptoms and don't feel unwell. They are what we call asymptomatic. They're not showing symptoms. They could be carriers. And then most people recover from the disease without needing any special treatment. Now, that's what makes this unique. And now they're still studying on how much someone could be asymptomatic and spread the disease, but also at the same time, they're still trying to understand and wrap their head around once someone recovers also. And approximately 1 out of every 6 people who has COVID-19 becomes seriously ill. And I like to focus in on that because when we say seriously ill, this means that someone's going into the hospital, that they're receiving medical treatment, that they are not that they are not having minor symptoms, that this is something that needs healthcare intervention. So with that, then, the group that is most vulnerable to this becoming seriously ill are older people, and I've seen anywhere from 60 plus to 65 plus to 80 plus. You can see that the fatality rates and the severity of this disease increases as people become older, but also underlying medical conditions of the most vulnerable. And so when we talk about most vulnerable can include asthmatic, someone who is a heavy smoker, someone who's recovering from cardiovascular disease or has cardiovascular disease, diabetes, living in poor air quality conditions. And so really being sensitive to that this is not just one group, this is a large group in the United States that we need to really take into consideration. So I want to talk about Mythbusters. One of the big things is I've been seeing on social media and out in the community and just being passed around via email is sometimes information that is not correct. So we know that coronavirus is not a foodborne disease. We know this is a respiratory illness. The toilet paper thing might be a psychological factor thing, but at one point they also had information going out that COVID-19 was found in toilet paper. I've seen things about, how it's reacting to temperature, to an email that's going on around about Stanford and what someone recommends from there. And what I'm going to tell you right now is that World Health Organization actually has a dedicated page called Mythbusters. And on this Mythbusters page, you will see a variety of different things that are out there that are not correct. So what's really important about this is to really keep people from panicking, is really giving them correct information and giving them proactive steps. What we don't want to do is put things out there that are incorrect. So know that as you watch this presentation, think how you can help bust myths. That's one thing you could proactively do. So I want to talk about excerpt from World Health Organization frequently asked questions. According to the World Health Organization, these are some of the frequently asked questions that often come up. People often ask how long and how severe could it be? What they're saying and what they're seeing is that recovery is around 2 weeks and it can take up to 6 weeks. Can you get it? Again, according to the World Health Organization, it looks like yes, but they're not quite certain yet. Are children vectors? Children seem rarely to become infected or are currently ill. It's still unknown how asymptomatic people can spread the virus or how they do it. And this last one I really want to stress. How hard will this disease hit? This absolutely depends on how seriously we take social distancing and public health best practices as a nation, and how soon we make screening and testing available free or low cost. And so this last one, making screening and testing available free or low cost, is something that the U.S. is starting to rev up and ramp up now. So this leads me to the next slide, that time is of the essence. We really need to start looking at social distancing and some of the public health best practices as a nation to start slowing down this pandemic. What I'm going to show you here is that this is a screenshot from the Center for Disease Control. And what you see is you'll see cases coming in back in January, and they're pretty low numbers. What you need to know is that we are past the containment stage. During this stage, the health department and public health professionals could have screened, could have isolated, and could have quarantined. But what we are now in is an epi curve that's going straight up, an exponential curve that's going straight up. And what that means is that for every one person, 5 people, for every 5 people, then it starts to spread again and it starts to go up and up. And this is represented when you see this graph, this chart here, you can start to see each of these case numbers going up significantly. What you see here is that illnesses that begin during this time may not be reported. So although you see this at the very end, it does not mean that these are the true case numbers that are coming in. We are still getting screening results back, and on average, they take about 5 days. Some may vary. And also, very important to note, not everyone can get access to a screening. So this does not represent a true number. We are finally ramping up. So when we look at pandemic levels and looking what's happening in other countries, we have an idea of what's probably going to happen in the United States and why you start to see everyone starting to really emphasize the importance of social distancing. Whether a country is prepared and how it responds makes a difference in whether this infectious epi curve, what you see here, the infection curve and disease progress going straight up. We can see Iran, we can see Italy, South Korea start to make some efforts and did some real screening efforts, and you could start to see them starting to bring their numbers down. And one of the big things that one of the big public health best practices really emphasize first screening, really figuring out about isolation, quarantine, and using social distancing. These are some of the big evidence-based strategies that are used to combat outbreaks. We, right now in the United States, have just started to see this epi curve take off. In many ways, Italy is a few weeks behind us. And so you could start, or ahead of us, one would say. They are ahead of us because you could see that if we were tracking like Italy was, and we see the time span from Italy and the United States, you could see that the United States really could start to go straight up just like Italy. But you'll see that countries that really embraced screening, isolation, and quarantine, Japan and Singapore, are trying to see where they're able to reduce that. Even with China is not on this chart, but you'll start to see that their numbers are starting to plateau. 2 really good resources are Johns Hopkins University, where you can see this in real time, where you can see the epi curves and the case numbers coming in. And the other one is the University of Washington, which this chart is using the data directly from the University of Washington. Now, here's the hard fact. Right now, we're bracing for impact. Remember before I said we passed containment. We are past the point of containing the virus. We are now on the point where we're going to have to start bracing for impact for the number of cases that are going to be coming into our healthcare system. I like this quote from the director of the National Institute of Allergy and Infectious Diseases. He basically said the U.S. system is not geared toward what we need right now. He actually talks about how we have failed with our screening efforts. So with that, then, we are at this stage. We are buying time for our healthcare system to brace for impact. And this is probably something you've probably seen out in social media, is that we are flattening the curve. Hashtag flatten curve. And this chart illustrates how when you do protective measures such as limiting travel, avoiding crowds, social distancing, and through frequent hand washing, you can actually take what an epi curve where it's going straight up and start to make it plateau and flatten out. So what this means then is we have a social responsibility. We have a social responsibility to really embrace 3 different strategies. 1, look at social distancing. This means that you're keeping a distance from people, but also you're reducing the impact of people that you're interacting with. This does not mean that you get out of school and you've got your kids at home and you're going to go hang out and have a little party with them and send them all to the coffee shop. This negates the whole purpose of social responsibility and social distancing. The next one up is quarantine. What that means is that if you think you have been exposed, then you reduce your interaction with people significantly to wait out the 14 days to see if you have the symptoms. And the last one is isolation. This means that you are sick, you're not sure if you have the coronavirus or not, but you are sick, and you completely remove yourself from your family. You separate yourself into another room if you can, and you try to isolate yourself and your interactions with people. What I want to emphasize is that the Center for Disease Control has a really good page called If You Are Sick. They just posted this a couple of days ago, and you can drill down and you can get very specific information on quarantine and isolation and the protocols for doing that. Definitely check out this page. So one of the big things I talked about is what you could do to proactively do if you are sick. And so again, going back to this, if you think I need to be screened, I'm worried, these are things that you need to know, is that right now, these are the 3 criteria that doctors are using to determine if someone is going to get a screening and tested. Not everyone's getting the screening. Now that is changing in some parts of the United States, but it is a priority because we do have limited screenings and limited capacity to do the analysis on these screenings. So these are the 3 criteria: a patient with symptoms, a symptomatic older adult, health personnel who's been in contact with a confirmed case or has been in an affected region. And then if you are sick and concerned, instead of going into a public area, what you need to do is first call a nursing insurance hotline, a virtual MD, or call your doctor. Do not go to the doctor in clinic unless you specifically need medical care, and call them beforehand because they are impacted. To see the specific guidelines, go to this CDC COVID website, which provides steps and guidelines. So this brings me to social responsibility. Probably this is one of the big things that we can proactively do collectively as a community. If a person tests positive for the virus and is diagnosed with COVID-19, the county health department will carry out something called contact tracing. What this means is this is an evidence-based practice which includes identification and follow-up of the person who made contact. They're going to ask you for a list of people that you've made contact or that we've made contact to monitor and follow up. And then based on that, they will then recommend quarantine or being isolated. Okay. So with this, I want you to think about this. Mentally keep track of where you go and who you interact with. I'd like you to think about this. Think back to the past 4 days. Could you produce a list of where you've been, the interactions with the people who could have been exposed? Now increase that to 14 days. That's what contact tracing entails. And that's part of the reason why social distancing is key, because not only does it help reduce the disease, it helps the health department and public health professionals help track down and contain the disease. So this leads me to the last couple slides. Social responsibility, kindness, and community. One of the big things is that this disease does not discriminate by race. This is not a European-seeded disease. This is not a specific disease from Asia. This is not based on nationality or ethnicity. This has nothing to do, if you see someone wearing a mask, it does not mean they have COVID-19. But one of the things that we can do to combat stigma is to be proactively putting out information that is up to date and reliable from CDC, local state health department, and posting the World Health Organization's information. You need to correct false and misleading information. Be proactive. Maintain everyone's health information on a need-to-know basis. You still need to maintain people's privacy. Avoid using adjectives like alarmist or rational when people are expressing concerns. And lastly, this is for the educators, the professors who are working with people out there. Really think about your lectures and presentations and really taking and using and embracing online learning. And I just want to talk to you. This is a local resident in Oregon, and Ben, who went to the grocery store. And I think when I read this out loud, I got a little bit taken back on the pure anxiety that this couple must have felt. She went up to this couple, and here she said she went up to this elderly couple who yelled from her from the car. And when she walked over, she found an elderly woman and her husband who cracked her window just to open a bit and explained to me nearly in tears that they were afraid to go into the store. So one of the big things, I think people who are not in that vulnerable population or who feel like they don't quite understand why people are feeling this way, you need to understand that there are some people who are very much at risk and they're having to change their lives. And being compassionate and understanding is really important in an outbreak. So I love this quote. Coronavirus is a socially transmitted disease, and we have a social contract to stop it. What binds us is a microbe, but it also has the power to separate us. We're a very small community, whether we acknowledge it or not, and this proves it. The time to act like a community is now. And so with that, I think it's critical that you sign up for your state and local updates. These are some examples of this that the local health department in Deschutes County is posting updates on a daily basis. Oregon is posting updates. California has their update system. Each public school system has their alert system. Go ahead and sign up for those. The other two is that, and I will be posting these links out, is that please bookmark the Center for Disease Control, World Health Organization. Go to the National Institute of Health for all your research questions around what's going on with this virus, because that's a great resource. Johns Hopkins and the University of Washington are phenomenal resources, and this is this article that the director of infectious disease was talking about. This is a great article to really kind of wrap your head around the purpose of social distancing. These are some of my references, and I want to thank the COCC, Central Oregon Community College COVID-19 Task Force, the leadership team, the phenomenal e-learning team, Dr. Karen Heckard, who was great and helped me go through all the materials for this, Chris Cruzboon, who helped with that, the presentation and my communication, and then, of course, the local health department resources and great resources coming from Kings County. So with that, let me know if you have any questions. Feel free to reach out, and definitely stay alert, but also most importantly, embrace social distancing.